Hello everyone, in this video we will be reviewing the frequently asked questions about the nervous system. Question number 1. How many pairs of the spinal nerve are found in human? A 33, B 31, C 13, D 12. Think the answer. The correct answer is B 31. The humans have 31 pairs of spinal nerve which exits the vertebral column. There are 8 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 1 coccygeal, that is coda equina. Note there are 33 vertebrae but only 31 pairs of nerves. Question number 2. Which of the following is the part of the peripheral nervous system? A. Durameter, B. Brachial plexus, C. Spinal cord, D. Pons. Think the answer. The correct answer is B. Brachial plexus. The brachial plexus is a network of nerves formed by the spinal nerves C5 to T1 that innervates the shoulder and upper limb. Nerves are components of the peripheral nervous system. The durameter, the first answer, is a meningeal layer, while the spinal cord and pons are the components of the central nervous system. Question number 3. Which of the following is the neurotransmitter that crosses the neuromuscular junction? A. Acetylcholine, B. Adrenaline, C. Noradrenaline, D. Calcium. Think the answer. The correct answer is A. Acetylcholine. You can see here the acetylcholine is a primary neurotransmitter released by the motor neurons to stimulate the skeletal muscle contraction at the neuromuscular junction. Question number 4. Which is called a basic unit of nervous system? A. Nephron, B. Neuron, C. Axon, D. Dendrites. Think the answer. The correct answer is B. Neuron. The neuron, that's also called as the nerve cell, is a fundamental structural and functional unit of the nervous system, responsible for generating and transmitting nerve impulses. But in this question, you have to be careful. The answer A, that is nephron. The nephron is a basic unit of the kidney. Question number 5. Which is the largest portion of the brain? A. Cerebrum, B. Cerebellum, C. Brainstem, D. Diencephalon. Think the answer. The correct answer is A. Cerebrum. You can see the picture. The cerebrum is the biggest part here. It's the largest and uppermost part of the brain, consists of the two cerebral hemispheres and is responsible for higher level functions like thought, language, memory, and voluntary action. Question number 6. Which of the following controls body temperature, sleep, and appetite? A. Adrenal glands, B. Hypothalamus, C. Pancreas, D. Thalamus. Think the answer. The correct answer is B. Hypothalamus. You can see the hypothalamus is here. It's a small but vital region of the brain that serves as the main control center for autonomic nervous system and the endocrine system. It is key in regulating homeostatic functions, including body temperature, thirst, hunger or appetite, and sleep-wake cycle. Question number 7. Which of the following is the body cavity that contains the pituitary gland? A. Abdominal, B. Cranial, C. Pleural, D. Spinal. Think the answer. The correct answer is B. Cranial. You can see the pituitary gland here. Pituitary gland is about the size of a pea. It's a small endocrine gland located at the base of the brain, sitting in the sphenoid bone. The cranial cavity houses the brain and associated structures, including the pituitary gland. Question number 8. Hemiplegia is a disorder caused by a defect in which anatomic system? A. Musculoskeletal, B. Nervous, C. Digestive, D. Integumentary. Think the answer. The correct answer is B. Nervous. Hemiplegia is a paralysis affecting one side of the body, for example, after the stroke. This is a direct sign of damage to the motor pathways in the brain, making it a disorder of nervous system. Question number 9. Name the part of the brain that controls blood pressure, heart rate, and respiration. A. Cortex, B. Medulla oblongata, C. Cerebellum, D. Cerebrum. Think the answer. The correct answer is B. Medulla oblongata. When you take the brain, down here it's a brain stem. The brain stem contains the midbrain, pons, and medulla oblongata. The medulla oblongata, located in the brain stem, contains the vital centers that control the involuntary autonomic functions essential for survival, including the cardiac center, that is heart rate, vasomotor center, that is blood pressure, and respiratory center, that is for respiration. Question number 10. The central nervous system, CNS, consists of which two main structures? A. Spinal nerves and cranial nerves, B. Brain and spinal cord, C. Autonomic and somatic nervous systems, D. Cerebellum and brainstem. Think the answer. The correct answer is B. Brain and spinal cord. The central nervous system is composed of brain and spinal cord. The peripheral nervous system includes the spinal and cranial nerves. So the correct answer is B. Question number 11. Cerebrospinal fluid (CSF) circulates in the space between the arachnoid matter and pia mater. This space is known as the A. Epidural space, B. Subdural space, C. Subarachnoid space, D. Vertebral canal. Think the answer. The correct answer is subarachnoid space. The subarachnoid space is located between the arachnoid matter and pia mater. You can see that between the arachnoid matter and the pia mater, and this is where the cerebrospinal fluid is found. Question number 12. Which region of the spinal cord has 12 pairs of nerves and is associated with the ribs? A. Cervical, B. Thoracic, C. Lumbar, D. Sacral. Think the answer. The correct answer is B. Thoracic. The thoracic region has 12 pairs of spinal nerves, T1 to T12, and is the only section where the nerves connect to the ribs or chest. Question number 13. The spinal cord typically terminates inferiorly at which vertebral level in adults? A. T10, B. L1 to L12, C. S1, D. C7. Think the answer. The correct answer is B. L1 to L12. You can see termination of spinal cord occur in the adults in between the L1 to L2, but in infants is further down L3. So the spinal cords and forming the conus medullaris usually between the first and second lumbar vertebrae. This is the crucial landmark for procedures like lumbar punctures. Question number 14. What is the term for chemicals that relay, amplify and modulate signals between the neuron and another cell? A. Neurotransmitters, B. Myelin, C. Ions, D. Hormones. Think the answer. The correct answer is neurotransmitters. The neurotransmitters are chemical messengers released at the synapses that travel across the synaptic cleft to excite or inhibit target cell, that is another neuron, muscle cell or the gland cell. Question number 15. The three components of the brainstem from superior to inferior are so there are four answers, so think the answer. So the correct answer is C. So superior to inferior mean from the top to bottom. So when you take the brainstem, the top to bottom are midbrain, pons and medulla oblongata. So the correct answer is C. Bonus question. Which cranial nerve is responsible for the sense of smell? A. Cranial nerve 1, that is olfactory. C. Cranial nerve 2, that is optic. C. Cranial nerve 7, that is facial. D. Cranial nerve 10, that is vagus. So think the answer and leave your answer in the comment section. And if you have any questions, please leave in the comment section. My channel offers guidance for the medical coding, especially to help you to prepare for the AAPC CPC examination. If you have any issues, please feel free to ask me. You can leave your questions in the comment sections, or you can email or WhatsApp me using the details displayed here. If you feel this channel is useful, please subscribe my channel and stay with me. Thank you.